but the fact that the stability and strength of this new organization is what it is. Two juggernauts in terms of economic and organizational strength are coming together. That is assured. The second part is with the importance and the focus that we both have on bringing a whole compendium of services, all the way from the Good Sam part of our new organization that deals with long-term care and senior care, all the way to the cradle, where babies are born by the hundreds every day in our organizations. We're going to be able to bring the third leg of that stool, the financing. Our focus in not only the care and the continuum of that care, but the fact that the financing is rational and that people in our region will have the choice, have the opportunity to buy their insurance from their healthcare provider in a way that reduces their premium or holds it to a rational level of increases. And I think those are the kind of things that people want leadership to be focused on, so that we can provide unbelievably great clinical care. And nobody has to look any further than Intermountain Healthcare to say what's the best in the country. What is the good housekeeping stamp of approval? It's been Intermountain Healthcare for a long time in this country. And those three things, I think, would really echo in the minds of a patient today.
And speaking of Intermountain, this next question is from Mark. Jackie with SDPB. For South Dakotans unfamiliar with Intermountain, could Mr. Harrison describe the system's specialties?
Sure. So I'm actually a doctor. So no offense to this gentleman. So I'm a pediatric ICU doctor who was trained in Salt Lake City in the early 90s and was gone for 20 years and then came back. So Intermountain is a large integrated delivery system. So we're headquartered in Salt Lake City. We are boots on the ground in Nevada and Idaho as well. We have, I guess, 23 acute care hospitals. Our 24th hospital is a virtual hospital. We've got about 250 practice sites. We've got a health plan that has just shy of 1 million members in it. About 750,000 people we take care of are full risk, which means that financially, which means that we're prepaid to take care of them, and then it motivates us to keep them well. And we have achieved some pretty extraordinary outcomes, as Kelby pointed out on that front. As a very large integrated delivery system, we provide the full spectrum of tertiary and quaternary care. And it's on the very rare occasions when somebody has something extraordinarily esoteric, of course, we'll send them to that best place in the world to get that care. But there's nothing that's routinely referred away from Intermountain Healthcare.
Next question is for Kelby from Jody Schwan. What is it about this relationship compared to other mergers attempted by Sanford that gives you confidence it will ultimately be finalized?
Well, first, thanks, Jody. She's a good friend. The thing that really intrigues me about this is sort of the mystery that I always had in my mind about Intermountain. I mean, the name, the location, and its storied history became reality when I met Mark. I mean, and it's all been extremely good. The other part is he's humble enough to, when I talk to him about the challenges we both have, the familiarity of those made me realize they're not that much different, you know. Our healthcare organizations, not counting the insurance, are almost twins in terms of their size, what we're trying to get done, and the talent that's inside. Numerically, we're almost identical twins in terms of the healthcare delivery side. It's the insurance piece that has challenged Sanford in recent times, because we've had a healthcare company, an insurance company, for 25 years, and we do a good job with it in this region, but we're stuck. to grow outside this region with our insurance in a mobile society has become a daunting challenge for Sanford Health. Meeting an organization like Intermountain Health with their reach and their reputation with their insurance company being 4 or 5 times the size of our insurance company, really was the missing ingredient. And what Jody's question, what makes this one different? It's that. It really solves a problem for us. Beyond that, it's really 2 great healthcare organizations that don't have any crisis, no scandal, no problem, no financial issues, coming together and saying, what can we do? With the guidance of a guy like Mike Levitt, your success rate goes way up.
Next question is for Mark. This is from Sebastian with Univision. How is the Hispanic community going to benefit by this? Do you have some statistics on your reach on Hispanics now that you'll be working together for more communities?
Gosh, so I don't have any statistics on the tip of my tongue. We have very significant outreach into the Latinx community in the areas that we serve. And Sebastian may be familiar with the fact that Intermountain has taken a very front foot approach to diversity, equity, and inclusion. In the last couple months, we have actually added equity as a value to at Intermountain as well as a fundamental. So it joins safety, quality, experience, access, stewardship, and now equity as the things that guide us. We're adding a chief equity officer and a medical director for equity and a nursing director for equity. We're making sure that we have the right scholarship programs in place so that we can build a pipeline of leaders right from the bottom up, and are making social investments so that our more diverse communities have access to everything that they might need, as well as an opportunity for them to participate in our supply chain from a diversity supplier standpoint. Something that I've been quoted as saying is that hate has no place in healing, and we all live and embody that to the extent we can, and look forward to working with the Latinx community in this part of the world as well.
Next question for Mark from Sean Means, the Salt Lake Tribune. What differences will patients in the Intermountain system notice in treatment or services by this merger?
None in the short run. So in the long run, I believe what they're going to benefit from is we will now have new partners for telehealth. We will have the ability to invest much more in the digital space that I believe Intermountain patients are benefiting from. As he may know, our new digital front door, My Health Plus, has had over 200,000 downloads since its inception just a couple months ago. There'll be more than 100,000, more than 1 million downloads by January 1st. We are going to be, when we make a digital investment, it will scale across the entire system. Having a larger system will allow us to make deeper investments. And then finally, we at Intermountain, I respect, and appreciate Kelby's lovely comments about our quality. Sanford's a great system, and I fully expect that there's going to be a lot to learn clinically from our colleagues in this part of the system, particularly on the rural health front. Sanford is well recognized as one of, if not the premier provider of rural health care. And I hope that we will learn a lot and be able to bring it to our patients and members back in the Intermountain West.
Could I, he used a phrase about a term scholarships, which it's triggered something. And I want to speak to the 50,000 people of Sanford and nearly that with Intermountain. So 100,000 people daily work for us and work with us. One of the things that we've taken great pride in is our cultural histories. And nothing is more steep and more significant than the cultural history at Intermountain and what they've done with a healthcare organization related to that. The same thing exists in the Sanford organization. I think we both use the term lightly and heavily family, and not just as a coin phrase on employee relations, but we're talking about the legacy of the people that work with us, the nurses, the doctors, the technicians, all of the people in all the different capacities. And we've both started using a tool, scholarships, to reinforce our labor demands in the future for one reason, but also to build that esprit de corps, that these people know this is their company and that their mothers and fathers may have worked for us, but we want their children and their grandchildren to work for us too. And that's why we've used scholarships. And nothing more profoundly states, I think, the security and the consistency that the people in both our organizations should have than that the leaders are looking out not just for the current generation of people, but we want to send a message to them that we want their progeny, we want their offspring for generations to come and work for us and be in healthcare. It's the most important, most incredible industry to be in this nation, and we want to encourage that. So not just for current, but future employees of ours.
Next question, Jacob with Dakota News Now. Once merged, are there any plans of expanding to other parts of the country?
So we think that the vision of affordable, high-quality care that's meant to keep people well is going to be extraordinarily attractive. And we believe that there are going to be hospitals and systems across the interior west of the U.S. that are going to want to join the team. We are looking for strong organizations. We want the number one or number two player in any given market. We want organizations that are not highly distressed, that are actually on sound footing. And we want organizations that are committed to a future that's better than the past has been for regular Americans to get the kind of care they need to A, keep themselves well, and B, that they can actually afford. And we think it's going to be there's going to be a natural attraction to this, and we are receptive and eager to have them join the team at the right time.
This next question is for both of you from Jeremy Fugelberg from Forum News Service. Both health systems were founded by two different traditions. Will that be a conflict in your shared culture going forward?
You want to go first, Cal?
Yeah, that question brings up an element of mystery or that there's some differences sometimes. And what I have found is quite the opposite. The fact that both of us come from proud religious histories actually is an incredible complementary element to the conversations, the friendships, the trust. And because I think it comes from the standpoint that way before Mark and I were even thought of or even born, there were people committing to the development of a system of healthcare provision in frontier states, in large urban settings, that was always premised on service and above self. And that, if you look at the mission statements, and if you look at the orientation process, the videos we show our people, we don't tell people to come and do a job for us. In fact, if that's what you want, there's competitors that you can go work for and have a nice career. You come here because you have a calling. You have an idea that emanates somewhere near your heart, not near your brain, that says, I'm here to take care of the sick and injured, and I'm going to put service to others above self. And then we take that and mold it into an incredible technical profession. And that is an amazing commonality between both of us. I'm proud of the Church of Jesus Christ of Latter-day Saints heritage. I'm proud of it, and I'm a Lutheran, okay? And I lead an organization that has its roots in Lutheranism and Protestantism and out on the prairie, because it was designed for a choice. And the fact that we're coming together with two organizations that have that common heartbeat, that's probably the most powerful strategic tool we have.
Kelb said that really nicely. In addition to that, I've had the opportunity to spend 5.5 years in the Middle East, building and running Cleveland Clinic Abu Dhabi. And as we opened, we had 3,500 people from 70 different countries, pretty much every faith tradition that you could imagine, every color of skin, all kinds of national dresses, different languages that people spoke at home, but they all spoke the common language of care for another human being. And I see no conflict whatsoever, only strength that comes from two great faith traditions and people who try and live up to the values of them.
Thank you. This is the last question for this morning. This is from Nick Broadway with WDAY News in Fargo, North Dakota.
Good.
Some people think jobs will be lost when hearing the word merger. Does this partnership come with any potential for layoffs?
Because WDAY is so close to me, let me respond to that. I'm really glad he asked that question because I think he knows what my answer is going to be. Fargo and Sioux Falls came together, and you would have thought we were putting Pluto and Mars together about 15 years ago. And the concern then, significantly spurned by people who were afraid of mergers, just as the question suggests, have witnessed and watched the largest new medical center ever built in the northern Great Plains, the single largest facility, and almost a doubling of employment in the greater Fargo region because of a merger. And I'm not going to predict the same thing with this merger, but I think the odds are so much more significantly on the side of momentum and growth and opportunity with what we're putting together here today that I think people should just look at the past history of this organization that I can speak for in terms of what happens with the workforce. But go ahead, Mark.
I have nothing to add.
Okay.
That's a great answer and I love the optimism. I think that's another part. These two organizations, at a time when healthcare is on its back foot, we're on our front feet. And we're going to deal with the challenges we have, but we're going to make the future better than the past has been.
Any closing remarks?
I just acknowledge the people we work with. It is true. We are living in a time of obviously electoral uncertainty, but more importantly, the stresses that go on every day in our institutions. I think Mark and I are here to inform the public in this hour, but I think all of our comments are pointed toward our people. That's what we do. And I think they need to be acknowledged here. I think they should be optimistic. Today, I hope they leave work and go home and tell their spouses and their families that they're working for a really vibrant company that's changing the state of things, changing the course of history here today, and that they're going to be part of it. We're going to make this really feel like they're touched by this, and in a very good way.
So one of my great colleagues refers to Intermountain and everything we do as being in pursuit of being a forever organization. Always there to serve people, to keep them well, take care of them when they're sick, to provide exciting places for have careers, to be good community members and partners. And I know Sanford shares that aspiration. Forever doesn't mean the same. And as we were asked to be a model healthcare system in 1975, Intermountain has continuously taken on big challenges. Starting a health plan, not easy. Starting a medical group, not easy. Transforming around value-based care, not easy. Implementing digital and tele, not easy. But boy, it's really paid off. This merger is the next phase of being a forever organization. It'll provide us with size, scope, and resiliency to be able to not only weather the current healthcare environment and economic environment, it provides us with the tools to thrive within that. We have no desire to just exist. We have a desire to lead. And I think that we will be a forever organization. We'll probably deliver care differently because that always happens. But I can guarantee you we're going to provide the highest quality, most affordable care that's as respectful to the people who work in the systems and are served by the system as is humanly possible. The best is yet to come.
Well, thank you, gentlemen. And thanks to everybody who was watching. This concludes our event this morning. Have a great day.
Thanks.
Thanks, everybody.
Thank you all.